Welcome to the Medicare mini course. This is video number 1, and I've been doing this long enough to realize that a lot of us just need smaller bits of information in order to be able to process things. When you look at Medicare overall, it can be overwhelming and complicated and hard to really grasp everything that you need to know. So what I've done with this mini course is I've broken it down into kind of bite-sized pieces. And if you sign up for the mini course on my website, you're going to get an email each day with a smaller portion video so that we can understand that. There'll be 5 emails in total that'll give us a total understanding of Medicare. And you can sign up for the mini course at www.medicareonvideo.com/mini-course. And you just put in your email information and we will email you 1 video per day just to make it a little bit easier. If you want to find it all together, you can just look under the playlist section on my YouTube channel, and there'll be a playlist with new to Medicare, Medicare mini course. Everything's right there. It makes it easy to get things done. So let's start with the first video. And again, very basic stuff. And we're going to start really first with what is Medicare. And Medicare really isn't all that complex. It's basically health insurance. It'll be your health insurance plan going forward. So whether you're coming in at age 65 or whether you're going to wait a little longer while you're still working and then coming to Medicare, it's basically going to take over your health insurance just like you've had all your life and cover you pretty much for the rest of your life. There are different ways to handle it once inside, so we'll understand that as we go through. But when we're talking about Medicare, it's broken down into different pieces. And the base part of Medicare is Medicare Part A and Medicare Part B. And I wish I could tell you why they break it down into these separate pieces, but Part A actually gets funding from a different part of government than Part B does, but that's really not of concern to us. We just need to understand kind of how they function. So Part A is coverage for stuff that happens on an inpatient hospital admission. So it's going to cover basically your room and board. It's a semi-private room in a hospital. It'll cover the meals and the TV and all that stuff that happens within room and board in the hospital. Part B covers pretty much everything else. It covers all the doctor stuff, the specialist stuff, outpatient stuff, medical equipment stuff. It covers everything that happens in whether it's a hospital visit or a regular outside the hospital visit, when you go to a doctor's office, specialist office, all that's covered under Part B. And they have different payment schedules. So Part A has a big deductible, Part B has a small deductible, and then Part B pays 80/20. So when you come into Medicare, if you're going to stay with original Medicare, which if you've seen my other videos, I certainly recommend, you'll likely have a supplement plan, a Medigap plan, that's going to cover a lot of the stuff that they don't. So at the end of the day, it turns into really, really good coverage and really, really good access. So it's terrific as long as we set it up the way that we want to get it set up. So that gives you a pretty good overview of Medicare, what it is, and kind of the foundation, Part A and Part B. There are other parts that you're going to need to understand. We'll go through those in additional videos. I hope you found this helpful. Stay tuned for the next video.